tell you about my journey and my experience with cataract eye surgery. I went to the eye doctor in 2024. was problems with my vision, and the doctor said that I wouldn't be able to pass the driver's test and that I needed cataract surgery. And with a new prescription, they could bring me up to borderline, but that wouldn't solve the overall issue. And it was probably July or so when I had gone in, and I really didn't want to start the process not knowing how long it would take to get in to have an evaluation and to have the surgery. So I didn't want part of this done on 2024 for my medical expenses for a deductible and then run over into 2025 and then have to meet my deductible again. So I waited till January and set it up, and the eye center that I'm using is Silverstein Eye Centers, and they're about 5 miles from where I live. So initially I went through, filled out the paperwork. They did the preliminary exams, and I think a week later they did the second series of exams to what I needed, and I talked to the lady who does the scheduling of surgeries and answers questions. And basically they have 4 levels of eye surgery. And this isn't LASIK or anything else. This is just for your cataracts. So the basic level is for cataracts, and they use a blade. That's what they said, blade. And that's covered by insurance, and they would put in a new lens. Then the next level up would be to take care of stigmatism, and they would be able to do lasers and also take care of your cataracts and put a new lens in. But the next level up is not covered by insurance, and that was like $3,000 per eye above what the initial cost would be. So that $3,000 would not be covered if I opted to go to the next level. That would be per eye, so $6,000. Then I could go up to another level, which the lens would have a better range of seeing, distant and near. And that one was probably, I think she said, about $4,500 additional per eye for that. Again, not covered by insurance. And then the next level up was even more advanced type of lens, and it's kind of strange because she said, they could tweak it after it was in. I'm not sure how or what or on that, but that was about $5,500 extra per eye. So it's like, no, I just need my cataracts taken care of. I know I'll be able to see long distance. It'll knock out my seeing close up and probably have to use readers. So I set it up for February the 13th. So 2 days before, they want you to start using some medicated eye drops, 2 different ones, 4 times a day. And they called me the week of that and said they needed to cancel because the doctor wasn't going to be there. And I'm like, okay, great. Now I got to redo my vacation and my wife. Anyway, I'm kind of glad because we had the big snowstorm down here on the 12th, though I set it up for the 20th, and the 20th happened to be the coldest day of the year for us down here. But anyway, I went in, checked in at 6:45, and when all was said and done, I was out of there by 8:15. So I get checked in, they take me into a room, and I would say there's like 10 gurneys situated around the room. I was going to be number 2 that morning to go in. They get me in there. They hook me up to a monitor on my right finger. They hook me up to a blood pressure on my left arm. And I didn't ask them, and I'll have to ask them this time for my left eye. they got these black clamps that go on your wrist, and they're not tight, they're just there. They give me oxygen and an IV. Now for me, I'm not thrilled with needles and things. I hate my blood being drawn. Also for me, the idea of having surgery on my eye, that's really not on my list to do, but so I'm trying to be as relaxed as I can and go with the flow here. They give me 4 separate eye drops in my right eye, which is to, I suppose, sterilize it and they say freeze it and to dilate it. After a while, they asked me, open your eyes and look around, and which I did, and obviously they're like, okay, your right eye's not moving. And then they said, we're going to give you your anesthesia. And pretty soon they said, all right, we're going to go in. And I could feel being moved around into a different room. You know, of course, you know, I can hear some talking, some music and stuff. And the next thing I know is they're like, okay, you're ready to get up. And I had my wife pick me up at 8:15. They put a bandage over my eye to help protect it, keep me from bumping it, getting in it, or stuff like that. And I had that bandage on, say, let's say from 8 o'clock that morning, and they said I could take it off at 6 o'clock that night. And again, I'm using the same medicated eye drops, 2 different ones, 4 times a day. And when I took the bandage off, I was in my bedroom, which is across from this, looking into the room, and I could tell that I could see the plants over here, yet it was like I was looking through a blue tinted plastic shower curtain, and it was like up close, and you just couldn't define anything. I could tell the outlines of my big plant behind me and stuff. And eventually that slowly faded away. Each day it was a little better. The first day I did have some itchiness in my eye, but that, like I said, by Friday night, that was gone. I did go in Friday, the 21st. They checked my eyes, gave me a drop for the eye pressure to help reduce that. After a brief exam, they gave me another drop to help bring it down more. And I went ahead and told them, you know, I was scheduled for the 27th for my left eye, which is now tomorrow. Today's the 26th. So I've been off work for that Thursday, Friday, and then I went ahead and took off Monday. And I really planned on going back to work Monday, but I can drive during the daytime pretty good, but nighttime, it just wasn't working. I tried using my glasses by taking out the lens over here and using my good eye with my eye that still had the lens, and that just wasn't working. It was some type of maybe depth perception, or possibly because the difference in what the light spectrum was in my eyes. As I mentioned, I was seeing this blue cast, and when I Googled it, it was saying that's not uncommon because your cataracts act as a light filter. So now that that's gone and you have a clear lens in, light does have a blue cast to it, and that's what your eye is seeing, and it has to integrate with your brain and everything. And the only way I can explain the difference between looking at you this way with the color cast and looking at you this way with the color cast is this one is going to be an incandescent light bulb which has a yellow cast to it, and this one's going to be the daylight LED bulb. That's the difference for me in the color shift that I see. I can see very well with my right eye, and instead of using my glasses, I can see really well because this is my dominant eye, even though the things, if I cover this up, everything's blurry, this takes over. And even I drove that way during the day, which was good, but at night, it just didn't work. So I did go back to work on Tuesday, which was yesterday, did well. My daughter-in-law drove me to work, picked me up, brought me home. So I'm hoping tomorrow when I go in at 7:15 for my left eye. And I'm kind of hoping I'm going to ask them if they'll let me like video, not showing people, but show you maybe the setup, the apparatus, and kind of explain what's going on. So again, we'll continue this tomorrow, hopefully, and continue when I do come home and explain what I am seeing as I take that eye patch off from my left eye and how things progress and how I'm viewing things from here on out. And I'm hoping this can answer some questions or help somebody with what they're thinking about doing or what they might experience. Though everybody's going to be different. This is my experience. This is my journey. And at night, they give you this patch. It's a clear patch. It's perforated. And when I saw it, I'm like, oh man, I feel like the Fly. So now they have you wear it at night just so you don't bump your eye and cause damage to it. So after tomorrow night, I'll be wearing both of these. Now I really feel like I'm in the Fly. My appointment time this morning was 7:15 for me to check in. And here's what the bandage looks like that covers my eye. I can take that off at 6 p.m. tonight. Start taking the 2 different medicated eye drops. I go back in at 10:15 tomorrow for the checkup on my left eye and then also for the weekly checkup for my right. So I'm just going to rest here in bed for a few hours. And it really wasn't conducive for me to try to video me being there on the gurney and everything. This time they actually put the IV up here on the back of my hand versus up in the elbow area. Did have the finger monitor on, the blood pressure, and I'd previously mentioned about these like black plastic little lobster claws, and they said they were also for heart monitoring. They put in about 4 eye drops to help dilate my eye and probably medicated drops, and then the last one was put in was kind of a drop that was kind of a gel type drop, then which would freeze my eye. And this time I had the same anesthesiologist that I had last time, which is good because remembered me, looked at my chart to see if everything went well and used the same procedure or the same amount. And she said this time, I don't remember her saying it the last time, but she said this time, you know, you might feel a burning sensation when they administer it, which I did. I mean, it affected like the whole part of my hand here. It didn't last long. And when I got there, there were 5 other people waiting. Now, I don't know if they was all patients or whether they were the people there to give the patients the ride home. So I was the 6th one there. How many people had been in there before? I'm not sure. I did ask the nurse how many people they usually did during a day. And she says it varies, I guess, probably upwards to say 20. Today, she said there was only like 11 or 12 different patients. So I went in at 7:15 and I was out of there by 8:45. And I don't necessarily feel groggy or unsteady. I am going to lay down and rest for a while. And so that's where I am. When I get ready to take this patch off, I'll see about turning on the video again and letting you know how my eye has responded and what type of vision, if it's still that light blue haze or whatever, you know, kind of how I explained it before, if that's still the same as with my left eye as it was with my right eye. And then we'll continue on the journey, my experience. It's time to take off my patch now. So I'm going to take off this part here that has the plastic shield. It hasn't been sticking too well, so I'm going to take it off first. And like I said, that's the plastic shield they want me to wear at night for a week. That helps protect your eye in case you bump it while you're sleeping, rolling over, or something like that. And they tell you to wash your face before you come in for the surgery. And I'm assuming that's because to get the oil off your face so the tape will stick to it. And also they tell you not to use any lotion, probably for the same reason. And also not to be using cologne or perfume. And I would think that's because of the doctor being over your eye. You know, some people want to put their perfume or cologne on pretty heavy, and so that just keeps them from breathing heavy fragrance. So, all right. So I got the bottom part off. All right. All right, let me grab a Kleenex because I've got some water or something here I want to kind of wipe up. All right. Well, at the moment, it's watery, and looking through this eye, it's the same way it was before. I've got that blue tint to it, and it's hazy, foggy type. Let me wipe off my eye again here a little bit. And I can see across the room to my sunroom where my plants are. And I would say, yes, it is in focus, except it does have that blue cast to my vision. So just give it time for my brain to function with my eye for what it's seeing. And now with both eyes kind of being open, I've got kind of a double vision thing going on. Again, that'll be integrating my eyes with my brain and getting it to function correctly. So I do have a doctor's appointment for 1-day checkup on this eye, and then the week checkup on this eye. And that'll be in the morning at 7:45. After I get home, I'll give you an update of what was said about everything. So I went this morning and had my checkup for the day after surgery for my left eye and the week checkup for my right eye. They checked for pressure to see if I was within reason with it. My pressure was still a little bit elevated on my right. My left eye was a little lower. My itchiness compared to my right eye was minimal, and I had mentioned I had a blue cast or fog over my right eye for a day or two, and with my left eye, that's gone already. And as far as the itchiness, it's very minimal. When I had my operation, I did take an Advil that night and an Advil the following morning because of the itchiness. And that's what I did this time with my left eye. They do check the pressure. It took them a little bit longer trying to do it because I guess they said with dry eyes, it's hard to get an accurate reading, and it took them a little bit of time to get it. They did give me real tears eye drops to use also with the medicated droplets. I go back in a week for the checkup on my left eye, and then in 4 weeks, things should be stabilized and integrated and everything like that with my eyes with each other and my brain for seeing. And at that time, then I'll get an eye exam to see as far as needing glasses, prescription. I have used my wife's readers, which were a 2.7, to be able to look at my phone and to say read a book, and that does very well. I have some issue with double vision, and it seems like I have things more in focus if I turn my head a little bit to the left versus if I start rotating to the right, the images start to separate. And again, she was saying that's just because of the healing process, the eye coordination with each other in your brain, and also with my eye still being dilated from the day before for the operation. So overall, she said, I'm doing very well. As far as driving, she said, yeah, probably by Tuesday, I should be able to drive unless there's something that comes up. So today is Friday. I did take off work for Monday just to give myself an extra day. So that's where I'm at with everything right now. It's doing very well. I can see in focus this way, and I can see in focus this way. Again, like I said, it's just coordinating the two eyes and integrating them together. So I will give you another update in a week when I get the weekly checkup with my eye. So this is Friday. I went in and had my checkup with my eyes. It was the week after having my left eye done. And checking both eyes are doing very well. They say I have 20/20 vision in my left eye. I can't remember what they might have said for my right eye when I had the weekly checkup. I do go back in, say, 4 weeks for the eye exam, and I will probably get glasses because right now I'm just using some readers 2.0. I did try the 1.75. It's all right, but I think the 2.0 works just a little better for me. And at work, you know, I gotta read the job ticket information, you know, or looking at my phone or texting and stuff like that, reading. I have to put readers on, have to carry them with me, carry them in my pocket, or if I lay them down at one room, then I'm in a different room. I need them, then I gotta walk back to go get them. I just don't like that. So I'm probably just gonna go ahead and get, say, some type of prescription glasses. Plus, I wanna have them where they're the transitions where I go outside and they get dark. This way, I can wear my glasses all the time, have them as protection for my eyes out in the sunlight. So far everything is going very well with me. Like I said, I go back in about 4 weeks for the eye exam, and then from the 6 months for a checkup, and then a yearly checkup. So I do want to mention something here on information that they give you when you first go in about the procedures and things, or say possible complications. So the first one is, I'm going to read here, is the medication side effect information. So they're talking about different things. All they have marked on mine was the sedatives for my anesthesia and everything. And it gives you the three, I guess, that they used, and the uses for sedation. So the possible side effects are drowsiness, lightheadedness, restlessness, amnesia, low heart rate, low blood pressure. Then it says, do not drive or operate heavy machinery for 24 hours. I can't say that I experienced any of those side effects with that. When you go in and you have this informed consent for cataract operation with intraocular lenses. So they're just giving you basic things. It says, I understand there are 3 methods of restoring useful vision after surgery: glasses, then contact lenses or intraocular lenses. So then it says you're giving permission for the cataract extraction, implantation of intraocular lenses in my eye, and you declare, and I understand the following information. Cataract surgery by itself means the removal of the natural lenses of the eye by a surgical technique. In order for an ocular lens to be implanted in my eye, I understand I must have cataract surgery performed either at the time of the lens implantation or even during a prior surgery. If an ocular lens is implanted, it is done by surgical method. It is intended that the small plastic lens, and it says with a polypropylene or nylon supports, will be left in my eye permanently. The results of surgery cannot be guaranteed. At the time of the surgery, my doctor may decide not to implant an ocular lens in my eye, even though I may have given prior permission to do so. Right here, as a result of the surgery, it is possible that my vision could be made worse. In some cases, complications may include hemorrhage, loss of cornea clarity, infection, detachment of the retina, glaucoma, injury to parts of the eye, nearby structures from the anesthesia, the operation itself, or pieces of the lenses that cannot be removed, high eye pressure, a droopy eyelid, and or double vision. Now, I did experience with my right eye, now whether that was because my eye was more affected by the cataracts than my left eye, I did experience some high eye pressure, not excessive. My wife's friend's husband experienced that, and it was excruciating for him, and he had to go in and they gave him a shot in the eye, which immediately relieved the pressure, and he was fine after that. But it's just the fact of getting a shot in your eye. I did experience some double vision on Saturday. Kind of weird with my wife driving and me as a passenger seeing multiple vehicles when I knew there should only be one of each vehicle, but that did go away, and I was really a lot better by Sunday. And I have took Monday off from work, and I've been driving to work since Tuesday, and again, this is Friday. These and other complications may occur whether or not a lens is implanted and may result in poor vision, total loss of vision, or loss of the eye. Insertion of an ocular lens may induce complications which otherwise would not occur. In some cases, complications may develop during surgery from implanting lens, or days, weeks, months, or even years later. Complications may include loss of corneal clarity, infection, uveitis, it's uveitis, iris atrophy, glaucoma, bleeding of the eye, inability to dilate the pupil, discoloration of the lens, and retinal detachment. At some future time, the lens implanted in my eye may have to be repositioned or removed surgically. As with all types of surgery, there's a possible complications due to anesthesia, drug reactions, or other factors that may involve other parts of the body, including a possibility of brain damage or even death. Since it is impossible to state every complication that may occur as a result of this surgery, the list of complications in this form is incomplete. So, as with any surgical procedure, no matter how advanced or how safe it is, you could possibly have some type of complication. Though I would say success rate and versus complication rate, I would say the success rate is a lot better than the ones where you're going to have issues or problems. So I will give you an update after I have my eye exam and let you know what I'm going from there. I have had my monthly eye exam. Everything is going well with it. I don't have any issues or problems. I did ask when I was there to have an eye exam so I could get a prescription for glasses. They said they would like to wait at least 6 weeks to 8 weeks, which would have put me another 2 weeks out or another month out, and for me that was just too hard. I said the work that I do, I have to be able to look across my machine and see what's going on, plus looking at the end product, which is right in front of me. So without my glasses, I can see out across my machine and watch it, but the end product is in front of me and I can't see that, so I have to put on the readers. So with the readers, I can see the end product, but looking out across the way, it's blurry because my readers are on. And I don't want to lean down or pull my glasses down or up and down, up and down. That's just too much. So they went ahead and did the eye exam, and so I do have my glasses now. A couple of things. Previously, I had mentioned I had some double vision. There were a few times, sometimes in the morning when I woke up, it took a little bit for my eyes to get coordinated with each other, if that's what you would call it. It was just trying to, I guess, integrate both eyes, what they're seeing with my brain and everything. That has gone away. I can open up my eyes and things are, say, in focus or where they should be. The other thing in the time that I've had this is out in the actual daylight outside of the home, and that would be when I'm driving especially, it's just so bright. It's just so different. So I went and bought myself a pair of Ray-Ban sunglasses, which helps a lot. The other thing that I have noticed is if I first wake up, say within an hour after I wake up, and I have to go outside, even wearing these, it's just, I just don't know if my eyes haven't acclimated yet, and it's just where I've got to squint my eyes, and mostly my left eye, and it's just like trying to drive with one eye. Though I know from the time that I get up in the morning till I go to work in the afternoon, it's a lot better. I don't have that issue where it's just so bright. But these did help. These are Ray-Ban, and I like the style. So that's really what I was looking for when I bought my prescriptions. Previously, the style of glasses I had are these right here. And I could go back with those, but I just kind of wanted something different. Like I said, I like the style. So this is the glasses that I have right now. And I like these. Somewhat different because I have always been used to wearing glasses. You know, to be able to see, I got to put my glasses on. And I could see here that was in focus, but anything kind of past that got out of focus. So I needed glasses, basically everything. And now I can see at a distance and don't need glasses, but I need to see things from here. Anything closer from here, closer, you know, I have to have some type of readers or something to be able to see up close. So it's just the 180, you know, from being able to see this way and not here, now to being able to see here but not here. So that's something to get used to. Or again, I mentioned, you know, wearing readers. Okay, you can see, but then to be seen up close, you got to have readers. Putting glasses on and off and carrying with you, and I did that. So transitioning from not having glasses to having readers and on and off, and then say driving, you know, I'm wearing sunglasses, and now that I have these prescriptions, which mostly is just from, you know, say here down, or the reader part, and everything else is a slight prescription in my right eye. So now I'm having to have my eyes and brain get used to wearing those type of glasses, and it's not that hard. It's not that hard. So at the moment, I feel for myself everything is going well. Do I wish I had never had this cataract surgery? Sometimes I wonder, like, oh, gosh, you know, would I be better off just dealing with it? But overall, I would say no, I'm glad that I had it. For me, if you want to say the minor inconveniences of the difference of seeing up close or far away versus having readers, and now with my prescriptions, I think I'm better off having the cataract surgery. So I have another appointment in 6 months. They'll check my eyes again for everything. And they had mentioned that if, you know, they see any scar tissue, that they will have that done with a laser to remove that. They haven't said anything about seeing anything right now. So hopefully this video will help somebody or give you some information or some insights, or I'm not necessarily saying it's advice, it's just my journey and my experience myself with it. So I don't think I will do a video in 6 months about that, and unless there's something that really needs to be said. So again, I hope this helps with something for somebody, and I just appreciate everybody watching. And if you have questions, you know, put down in the comments. Hopefully I can answer them for you, or you know, try to explain something that you might have a question of that maybe I experienced. So hopefully everything for people who have this has gone well for them. I know I've seen some other videos where people saying they still experience different issues, and I'm glad I haven't had that. So I appreciate you guys watching.